And thank you for coming, and good night. No, just kidding. It is a pleasure to welcome all of you to the Hawaiian Financial Music Hall. And as Flash mentioned, yes, I'm Rick, and I've been with iHeart and KHVH Radio. It will be 31 years coming up in September. And I mention that because over that period of time, I've been blessed to work with so many people in our community. But rarely will I take the time and do a strident endorsement, testimonial, validation of various business that I come in contact with. And tonight's one of those very special times with our friends at Next Genesis Healthcare. Want to, once again, as Flash mentioned, want to thank very much Papa John's, Monster Energy, Coca-Cola for their sponsorship and support. And once again, parking validated at the end of our seminar evening tonight. What we're talking about, if you listen, does anybody listen to the morning show? Do you listen? Thank you. Thank you. Does anybody, you do not listen to the morning show? The doorway is no. There you go. After. Thank you, Papa John's. I make it a point to talk about Next Genesis during the morning show because what I try to do is take personal experience and convey it to our friends that listen and that are dialed in. I believe I'm very transparent and very precise in the issues that I face, and if we have that in common in some way, shape, or form, then maybe resolution to these issues, we can enjoy them together. It's all about pain. It's about living with pain. I turned 64 this year in just a few months. And for a great number of those years, that's me, living in pain, discomfort, lack of mobility, neuropathy, and various and sundry other issues. I am not, if we have anybody who is, that's great. I am not a fan of pharmaceuticals. I don't like them. I don't want to take them. I don't want to introduce them into my body. I don't want to have a combination of different medicines, etc. I'd rather go the natural route. But there really wasn't anything aside from acupuncture and physical therapy that was recommended for me to resolve the issues that I had. Nothing against PT, nothing against acupuncture, but it wasn't fulfilling. No surgery. I don't want to go under the knife. It's just something I can't see doing. And because of schedule and lifestyle, it's tough. You can't have a lot of downtime. You got to be up and running. You got to get your stuff done, right? And so the combination of all of that led me fortuitously to the fellas that you're going to meet coming up. Specifically, I had a bad back for so many years. Anybody have back issues, back pain? Yes, it sucks because it affects everything. For me personally, I've talked about shoulders. Shoulders were a mess to the point it progressively got worse. The right shoulder, not as bad as the bad boy, the left shoulder. It was my birthday in 2023. The boys and I went to Kauai. We had a long golf weekend, felt good, did pretty well, not bad. Shortly thereafter, at the beginning of the year, it started to devolve. I found myself less mobile. I found that even to do rudimentary, just basic things was very painful and difficult. I admit I drive kind of a smaller car. All right, it's a Jaguar. It's a two-door coupe. That's my car. I'm in my 60s. You have to have one, right? I couldn't get in and out of the vehicle. I could not do it without great effort. It got to the point where I had to ask Zachary or Zoe, if we were together, they helped me out of my car. And I just went, that's enough. That's enough. I love the game of golf. I stopped playing golf. I stopped from the first of 24 till the latter part of the year. I went on the course 2 times, and I could barely swing the golf club. It was then, end of 24, that I connected with Next Genesis. I'm going to say this. My mobility is back. I'm back on the course. I can swing and I can play. I can get in and out of my car. If it wasn't for Next Genesis, I would have never realized that I actually had arthritis in my back. But they identified, they treated, and the procedures that I went through were low impact. Yes, when you're talking about stem cell regenerative treatments, a little bit different because you're using your own body to heal yourself. And the process to do that, yes, it is very effective, without a doubt. I've been back for 2 follow-ups, and things are progressing at a point I never thought it would. I just never thought I'd be able to do the things that I love. If this story is similar in any way, I'm so glad you're here, because you're going to be able to see firsthand, talk to the gentlemen that know exactly what the possibilities are and what you can experience as well. That said, I want to introduce both gentlemen. They are with us today, and they'll come up to the stage, and they'll give a presentation that will walk you through any questions you may have, provide information to where you can make a great decision. The first gentleman is the name that I mention all the time on the radio, for good reason. He's the gentleman that I first met, along with Dr. Pico, with Greg. The first time we met, we didn't talk about anything. We talked about football. We watched an LSU football game, and LSU was on the verge of losing late in the 4th quarter. But they pulled it out, they won, so it was a good meeting, I guess you could say. The gentleman that I'd like to introduce to you is Dr. Charles Song. Dr. Song. I'd also like to welcome a gentleman that is also a key partner in all that takes place with Next Genesis. He has international experience. He is coming back here to Hawaii on a regular basis. And the great thing about it is that we're going to be able to spend time with him tonight, and you'll be able to spend time with him in the future. Folks, would you please welcome Dr. Lawrence Bourgeois. Lawrence Bourgeois. What's up, brother?
Thank you for having me.
Thank you. Thank you.
Right. How's everybody doing? Good, good. So thank you for those words, those kind words. The things that we're doing over at Next Genesis Healthcare are life-changing for a lot of people, right? If, everybody, the biggest thing that we deal with when we get people in is we want to find out their why, right? Why do they want to get better? Maybe it's to get in and out of their Jaguar, right? Those type of things. Sometimes we had patients recently, look, they just wanted to go have dinner with their husband, right? Sometimes it's the simpler things that aren't so simple anymore, right? As you get older, your joints break down, the disc problems that are associated with getting older as well, and that's why people come to us. The whole point of what we do is to keep people away from as many unnecessary surgeries as humanly possible, right? Medicine's a beautiful thing, right? It's great that we have these options, but they're entirely overdone, right? I think we could probably all agree on that, right? Nobody wants surgery if you can avoid it, right? So I'm going to go through a PowerPoint presentation and kind of map out what the traditional route of medicine is, and then talk about what we do that's different. A lot of you who have been hurting for a while, you're going to say, yep, that's exactly what I did. That's exactly what happened when I went to my primary doctor or my ortho or whoever, right? Because you have to have all the information in order to make an educated decision on what you want to do with your life, right? And with your health care. So let me grab this. All right. So, the whole point is to get you out of pain, happy, healthier life, do what you want to do, and avoid as many unnecessary surgeries, like I said. Who has arthritis? Most of you, right? Starts at age 30. You don't typically have the symptoms at 30. That's just when it starts, and then it comes and gets you 50s, 60s, 70s, 80s, right? There's different types of arthritis, different causes. There's micro trauma or there's macro trauma, right? Micro trauma is going to be the, I work for UPS and I'm getting in and out of the truck day in and day out, right? And it just kind of accumulates, and then now I'm hurting all the time, right? It doesn't start out very severe, right? It's very minor, and it creeps up on you. The macro trauma, that's going to be more of, I had an old football injury or old surfing accident, that type of deal, right? And then, okay, it didn't heal up correctly, and 10 years later, it's killing me. Anybody been there? A few of you, right? So that's your macro trauma. What they have in common is that they cause proteases to accumulate in the joint space and the spinal column, wherever the issue is. Now, proteases will actually degenerate the area, and they can cause arthritis and also cause cartilage breakdown from a bone-on-bone type of people. Is anybody out there with bone-on-bone? We'll talk more about that a little later. Okay, so medicine. I'm going to throw a few stats out there that are important, that I think that you really should know. Nobody wants to take medication, or most people don't want to take medication if they don't have to, right? You want to stay away from it. They had a stat, people over 65 years old, 70% were on at least 10 medications. Isn't that crazy? Wow. Yeah, it's crazy, right? So, look, they give you one med, and then now I'm nauseous, right? So I give you a med for that, and then it's a constant cycle. Next thing you know, you're on a million different meds. Anybody been there? It's horrible, right? And all the while, you don't want to be on it, and they're not doing anything to actually fix the problem. You want to fix the problem. You don't want to cover up with Band-Aids, right?
Sorry, Doc. One thing.
Yeah. Yes.
Jump in. So this is something that I share with my patients as well. Now, there's a time and place for medications, right, depending on what it is. A lot of people on things like blood pressure medications, cholesterol medications, and yes, depending on the circumstances, they can be very important. The problem is, no one is ever given instructions on how to get off of it. They oftentimes take these medications for the rest of their lives, right? When in fact, there are ways naturally to lower those things, blood pressure, cholesterol, right? And at that point, we're talking about overall wellness and health, right? So.
Yeah, 100% right. Of course, there's time and place for everything, like I was saying earlier. If you have to take this medication, you have to take it. That's why I was saying it's a beautiful thing that we have medicine when needed, but if you're able to get off of it, then, that's what you want to do, right? So let's talk about pain meds. This is another big stat right here. Pain meds, opioids, okay? Anybody have an idea of how much of the pain meds the United States actually takes in the world? 80%. We take in 80%. Okay? So of all the pain meds in the world, the United States is actually taking in 80% of the total supply. We're 5% of the world. So 5% is actually taking in 80. It's crazy, isn't it? I see you shaking your head, and it's just like, it's unbelievable. It gets me. I shake my head every time when I hear this. And there's a lot more big ones too that I'll go through. Right? We have the most doctors, the most resources, the most money, the most everything, right? But the typical route is going to be, let's give you pain meds, and to cover things up, right? When the ultimate goal is really to fix the problem. We have a reactive rather than a proactive healthcare system in the United States. $4.9 trillion is actually spent in medicine in the United States a year. Okay, so this is another pretty staggering stat that a lot of people haven't heard. In the U.S., the United States and New Zealand are the only two countries in the world where you can actually advertise pharmaceutical medication on TV. Anybody know that? That's crazy. So when you see, you see the commercials, could cause death, suicidal thoughts, all these horrible things, right? They have somebody running on the beach while they're saying the worst stuff, or there's a cookout while they're handing food off when they're saying all these horrible things, right? Us and New Zealand are the only two countries. So when I hear those stats, I said, okay, well, it's a direct correlation to why we're taking in so many medication. Now, anybody have a guess of in the top 100 countries in the world at treating chronic conditions where we lie? 100 being the worst, 1 being the best at treating chronic conditions.
94.
69. So a little better than that, but 69. Okay? So to put it into perspective, Albania, Jamaica, Costa Rica, Iran, all those countries are better at treating chronic conditions than the United States, right? It's crazy, right? So again, direct correlation. 80% of all of the pain meds are taken by 5%, but we're still not. I mean, we gotta be at least top 5 or top 10, right? This just doesn't make sense. We have too many resources to be 69th in the world behind all these other countries. Okay, so that's it with the stats. Let me do what I said, where I want to walk you through the traditional route of medicine, right? Who's my knee pain people in here? I'm going to get a feel for who do we have mainly. What about low back pain? Okay, hip pain. Okay, shoulder. Okay, so first step, say you have knee pain. First step, doesn't matter, any of these type of pains, doesn't matter. First step, what are you probably going to do? You're going to go try to manage it yourself. You're going to do ice or heat, maybe some ibuprofen or Tylenol, right? And then hope that it's just like every other time where, okay, it'll just get better on its own. Well, the problem is, as you get older, it doesn't commonly get better on its own. That's the issue when you get to a certain point. So then you say, okay, well, this one's not getting better like it always has, so let me go to my doctor, right? I'm going to go to my doctor, check it out, see what they have, right? You go to your doctor. Anybody know what commonly is next? Cortisone, correct. Cortisone or steroid injections, okay? Anybody had those in here? A lot of you, probably most of you if you've been hurting for a while. The problem with steroid injections, well documented, is it does a plethora of negative side effects with it, right? Sure, they can get you out of pain quickly, and I'll talk a little bit more on that in just a little bit, but what they do is they actually damage the joint significantly, and in a lot of cases, that pain relief stops. Because how it's actually getting you out of pain short term is it's synthetically killing inflammation but not fixing the problem, right? So steroid or cortisone injections, what they do is they accelerate arthritis in the area. They break down the cartilage in the area. They raise your blood sugar through the roof. So if you're diabetic or on the edge, it's a big deal. They've been proven to cause cataracts in as little as 3 injections. And they can cause bone loss, up to 8% of bone loss in just 4 months. So if you're osteoporotic, it's a real big problem there, right? All these issues, all the while they'll break down your tendons and ligaments. In sports, for instance, baseball, in the early 2000s, really common for a pitcher, their arm hurt, their elbow, shoulder, whatever. They would get a steroid injection so they can get back out there real quick, right? Get rid of the inflammation, get back out there. Well, what they were finding was that these people are actually getting hurt more. It's because it weakens the tendon and ligaments in the area. They're actually getting more injuries, so they don't do that anymore. They stop. They do different things like stem cells, platelet-rich plasma, some of the things I'm going to talk about today. Okay. So step 1, it might be the cortisone injections. Or it may do physical therapy, okay? And then you spoke a little bit about that. Physical therapy is a great thing, right? If it's a muscular issue, it's fantastic. It can help strengthen, stretch, make that better. The problem is when it's a structural issue. If there's a cartilage breakdown, if there's a severe disc problem, if there's just osteoarthritis, serious osteoarthritis in the area, it's not gonna fix the structural problems. You have to work on both aspects, right? So physical therapy might be done. Cortisone injections might be done. Then next, maybe some pain meds, Flexeril, some other type of medication, right? Which we all know does not fix the problem. So when you get to that point and none of those work or work well enough, next step, anybody know? Surgery, right? So that's the route of the traditional medical route that a lot of you are probably very familiar with. Now going back to the steroid, I do want to hit this again, where when you do the steroid, you could get some temporary quick relief. So you might say, okay, well great, it's better, I fixed it. 4 months go by, if you're lucky, maybe a little longer, right? At that point, okay, well, it worked, but now it's back, so let me go get another one, right? And then, okay, well, now this one lasted, 2 months, but okay, I got relief, let me get another one, right? Then 3 weeks, then, okay, this one lasted 2 days. Now you're in a worse position because it's been destroying the joint all the while, and now it's not getting the relief it used to. Has anybody been where they used to work and they don't work anymore? You? Yeah. So, too. So you know exactly what I'm talking about. Yeah. So that's that. Okay, and just go over the options of surgery and steroids. Now, right here, I just want to show you right here on all the way to the far left, it is showing a normal joint. Okay, that's the joint space. You can see where it's darker. That's going to be, that's where the cartilage lies, your meniscus. That's a healthy joint. The one right to the right of that knee joint is, you see there's more white in the area. There's less spacing in there where it has the red arrows. Okay, that's a more degenerated arthritic joint, probably a lot of cartilage issues, right? Same deal on the other one. It's a hip. On the left side of the left picture of the hip joint, there's spacing. On the right, there's not. The whole point is there's different levels of degeneration in arthritis. The whole point of talking to you about this is to get to you before you get to the last stage. That's stage 4. 1, 2, 3, 4. 4 is the absolute worst. When you get to 4, there's not too much that can be done other than surgery and maintaining it, right? We work on 1, 2, and 3. So the whole point is to get you before you get there, because what we know is once arthritis starts, like I said earlier, it gets worse with time, right? And this is piggybacking on what I said earlier. Dr. Ali says that the steroid injections aren't as safe as we thought. They accelerate arthritis, and they hasten the need for joint replacements, and they're toxic to the cartilage. Okay? Here's another one. It might be hard to see in the back, but right here, this is imaging where their patient had spacing right here. You can see where the arrows are. They did 7 weeks later, they had a steroid injection. 7 weeks later, over here, they have much less spacing. So the fact that you can see that imaging is very telling, because you don't see small changes typically on imaging, right? Okay, from a back pain people. So this is the Spine Research Foundation, the study they did. Okay, low back fusion. Anybody been recommended a low back fusion? Anybody? Okay. So here's the problem. Okay, low back fusion, in the study, they had a 35% success rate, okay, on the young, slim, and athletic 2 years out. So after 2 years, he said, okay, 35% success, right? If you're young, you're slim, and athletic. The average age is 54, right? So that's, the people that are getting it aren't in that position, so you can only imagine that it's going to be worse, right? That's just the cold hard truth. Okay, so when you have a spinal fusion, anybody ever heard of somebody where they had a back surgery and then, okay, now I need another one, and then another one? Next thing you know, they got 4 surgeries, right? So this is one of the reasons why. So you can see on the picture where there's the metal, the titanium in there, they fuse the spine. It's exactly what it sounds like. It's fused. That means it's not going anywhere. So the problem is when they fuse it, well, when you go to move side to side, forward, back, that area is not moving. So then the areas above and below it, they're picking up the motion. They're picking up the slack for it. So it gets what's called alteration of motion segment integrity. Basically too much motion. So when you have too much motion, that causes instability, it causes disc problems, and then it causes arthritis, right? So then whenever you have those issues, what do you think they do next? They go and then they want to fuse it, right? They'll do the steroids, the physical therapy, all the same deal, and then they'll say, okay, time to fuse it. And then it's a cycle. It's a constant cycle. And this goes for really any type of fusion this is commonly done, whether it's neck, mid-back, low back, you name it. Another problem, one of the most common long-term reasons for failure of a joint replacement or a fusion is actually the bone deteriorating around it. Because that titanium they put in there, it's going to stay strong, right? The problem, but your bones, they get more brittle over time. So if you're osteoporotic or have osteopenia, it's a real concern. Okay? And then not to mention when you have surgeries, you have risk of blood clots, nerve damage. We see that all the time where they have foot drop and then infections. Okay? So they did another study 1 year out after a low back herniation surgery, and 25% of them had complications, real complications. I don't mean they're just still hurting, they're still in pain. I mean really, really having serious stuff like neurological issues, loss of bowel bladder, these type of things, right? So these are the risks that you run up against. You know, anything in life, we don't go to the most drastic measure before trying something conservative, right? So, okay, we covered that pretty good, right? The typical route of medicine, what are your other options now? So at Next Genesis, we do joint rejuvenation, regenerative medicine, okay? That's help heal the body naturally without medications, surgeries, downtime that goes with it, right? So I'm going to go through a few of the different products that we commonly use, okay? So we'll go through it. So A2M, alpha-2 macroglobulin, PRP, platelet-rich plasma, okay? And then the bone marrow stem cells, okay? I'll go through each one by one. So A2M. Remember in the beginning when I was talking about arthritis where proteases, kind of eat the joint space up whenever you have macro trauma or micro trauma in the area and then it just accumulates? Think of those proteases like Pac-Man. They're just eating your knee up slowly over time. What A2M does in the body, it actually it inhibits those proteases. It inhibits the Pac-Man essentially, right? So it stops the cause of degeneration to the cartilage in the bones in the body, right? It stops the cause of arthritis in the area. So that's a common biologic that's used in order to do that because, the majority of the people we see they have osteoarthritis, right? Just probably like almost everybody in here, right? Okay, bone marrow stem cells. Anybody done any homework on stem cells or learned anything about it? Some people? Okay. So stem cells, what do they do? So they differentiate into all the different type of cells in the body, right? Wherever there's inflammation or pain, they go to that area and they replicate and they help construct the area. Think of them like the construction crew going to build. The problem is when you get older, they don't work quite as well, right? They're not the same potency, not the same consistency, not the same quantity in the area, right? So think of somebody like a little kid, okay? They get a cut, break their arm, might not be such a big deal. They heal pretty quick, right? They're pretty resilient because they have a high amount of active stem cells circulating throughout. You think of somebody who's older, it's a 100-year-old. They get a cut or break your arm, well, it could be a big deal, right? Because you have a lower amount of stem cells circulating throughout. So what we do is we take them, we concentrate them down, and then we inject them directly into the area where it needs to go so the body can do what it's naturally designed to do. Your body wants to heal itself. It just doesn't have the material like it used to in the high enough quantity. So that's a little bit how stem cells work. They have the potential to regenerate into cartilage, bone, muscle, tissue, every cell in the body, right? That's the job in the body is to differentiate whatever cells are needed, okay? So it's really cool stuff. This is kind of the mecca of biologics, if you will, with the stem cells. They're used for all type of things. Our focus is more on joints, spinal issues, hair, of course, hair growth, skin, erectile dysfunction, that type of deal to help heal the tissues so we can regenerate and move on. Okay, and this is going back on what I just said. It's saying that the concentration is really important. We get it real concentrated and then we inject it. Okay, so this is really cool. I added this slide because I thought it was really, everybody knows the Mayo Clinic, right? It's a pretty big time, right? They're doing thousands of studies regarding stem cells, whether it be osteoarthritis, spinal cord issue, type 1 diabetes, Parkinson's, stroke, heart disease. Now we're focusing on the joints, like I said, right? But what I found really cool is that the spinal cord issues. Did anybody see that segment on Good Morning America? It was probably 2-3 years ago, where they had a surfer. He had actually had a neck injury and he was paralyzed. Right? It had been about a year or two, completely plateaued, had no use of his body. Right? They said, okay, well, let's put you in this study and let's inject into the spinal cord region and see if we can get some results, some kind of response, to see if we can help. He said, you know what, whatever, do whatever you need to do. He was desperate at the point, right? Of course. So they did it. Within days he was feeling, weeks he was moving, months he was walking. This is on Good Morning America. If you type in, paralyzed man walks, Good Morning America, it was live on the show. Really, really cool. So I say that to show you the healing capabilities, what stem cells could do, right? There was a disconnect in his spinal cord, and it was able to get in there and do what it had to do to regenerate and heal the area, right? So it has the potential to do that throughout your whole body. So it's really cool stuff. Okay, and that's going what I was saying, how it regenerates all the different type of cells, cartilage, bone, muscle, tissue, every type of cell is what stem cells do in the body. Okay, platelet-rich plasma. So any of my shoulder people, rotator cuff people, the MCL, LCL, PCL, any tendon, ligament, you name it, right? This works really, really well with that, platelet-rich plasma. Okay, basically it's the plasma. It has the platelets and growth factors, all the good components of the blood that are concentrated down and injected into the areas. It helps with osteoarthritis as well, helps lubricate the joints, but commonly used in sports especially too, because there's a lot of tendons and ligaments. When I said earlier when they were doing the steroid injections, they don't do that anymore. Well, now it's focused more on PRP, this right here, and then also stem cell injections. Okay, this is really cool. Let me get where I can see this real well. So before, if you look at this picture on the right, it's real cloudy. This is a knee. It's real cloudy over there. All the way to the right, you can see that there's a little darker. That's where the spacing is on the outside of the joint. On the inside, it's not so much there, right? So this patient came in. He was 75. He had significant heart problems. He had open heart surgery. He was diabetic. He was overweight. He was told, by his ortho, you need a knee replacement, but I'm not going to do it. You're not in good health, so we can't do that procedure on you. Unfortunately, you're just going to have to live with it, right? It's not, and it's understandable. He has very, very poor health, right? So he saw us on TV, said, you know what, let me call him, let me see if they can help me. So we accepted him for care. This was 7 months later. We took imaging. Right here, you can see throughout the joint on this area where you couldn't see, you can see the joint spacing there. Pretty cool, right? Pretty cool image to see. They also had a PubMed study, and you got to be real careful with your studies nowadays, right? You got to know which the good ones are, because there's a lot of bad ones too. PubMed, they're very good, right? There's a PubMed study. It was knee cartilage. They injected into the cartilage in a knee. They did an MRI before. Okay, 24 weeks later, they did another MRI, and they noticed significant cartilage growth in the area. Okay, significant cartilage growth in that study. So really cool stuff. Okay, here's one of our patients over here, and I'll let her tell her story. Basically, she was in 10 out of 10 pain. She told she needed a knee replacement, didn't want to get it, so I'll let her go.
It was a 10. I couldn't do anything, not even stairs. Yeah, and walking long distance was really bad. Even after the first time, I saw a difference.
So you were up and about on your feet a lot. Any pain in your knees at all?
No.
No, nothing?
No.
Over the last 2 weeks or 4 weeks or so, any trouble doing anything?
No.
Okay.
No.
Have you squatted?
No.
Okay.
I haven't.
You haven't tried that yet?
No.
Okay.
No.
And I want you to kind of like sitting in the chair, I want you to go down and squat, okay? But don't sit on the chair.
Don't sit on the chair.
Yes.
Okay.
And up. Any pain?
No.
Are you able to squat down a little bit further?
No.
That's okay. Any pain?
Oh, no.
No pain at all with that?
No.
Okay.
It works. Even my daughter, when she saw me, she was skeptical at the first time I told her about it.
Mm-hmm.
But then when she saw me, she's like, Mom, I see a difference. You can walk. And I'm like, see, I told you.
What's really cool about that is, squatting down, that was a big issue of hers. Squatting was a real big issue. You heard she hadn't tried it because she knew it was going to, you ever been in that position where it's like, oh, if I do that, it's going to put me in a lot of pain, so I don't do it, right? That was her. So she was hesitant about it, but then she ended up doing it. So, wow, this didn't hurt. Your body just is programmed to think when I do certain things, it's going to hurt, right? So that was really cool to see there. Okay, so I like to end it with this, and of course I'll take questions, but I like to end it with this. Why do you want to get better, right? Of course we all want to be out of pain, right? But you got to think, you were where you were 5 years ago. Now think of where you are now. In a lot of cases, it's probably worse, right? Now think of another 5 years if you continue down the same path, right? You really need to be proactive with your life, and that's why I get up here and I talk to you about this. And everybody here is doing everything they can. They're here. You're all here listening to what I have to say because you're looking for a different option. You're just looking for the right one. You don't know what the right one is, so you're here to get more information, which is admirable, right? Are you like the patient that I talked about who just wants to go to dinner with their husband? Do you want to go to some of the other outer islands? Do you want to go surfing again? Whatever your why is, we go over with you, and then we work hard to make sure you achieve that. Or do you want to get in and out of your Jaguar, right? So those type of deals. This is a really powerful video that I like to show. It kind of hones in how things can go. Everybody's where they're at right now because of whatever decisions or wherever they are in life, but you can control where you go from here, right?
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
Okay, so, what's the next step, right? I'd like to get you all in for an examination to see if you're a candidate. Not everybody's a candidate. We're very upfront with you. If you're not a candidate, we're going to tell you where to go. We're going to get the best help you can get, right? If you are, we have the potential to change your life, and we'll talk about prognosis on where you're at based on how you present. So how it works is you come in, we do a consultation. We have to get all the information on your specific case. Okay, from there, we go over goals. Like I said, that's super important to us. We want to make sure we're getting all your goals down and what you're trying to accomplish and achieve. From there, we do ask you bring all of your imaging, any imaging you had in the past. We like to see all of that, have it all with us so we can look at that, and then we determine if you're a good candidate. If we need to do any other ordering of any other test, imaging, whatever's necessary, we do it at that point, and then we get you back in and we do a report of findings. Okay, if we have everything we need, then we have everything we need. But if we need to get more, we will. So from there, at the report of findings, that's when we talk about what we're seeing, what the prognosis is, if you are a good candidate. And like I said, if you're not, no harm, no foul. We push you wherever you need to go to get the best care you can get. All right, some of you might not need some of these things, so we just have to see where you're at. Whole point is to check that out, right? So everybody, here at the seminar or listening in, streaming right now, guys, the normal price that we're at is $87. We're in a group setting. You help me out, so we give you a deal. It's $27. So $27, you come in, get the information, and then find out if you're a good fit. That's a pretty good deal, right? And we all know, Hawaii prices are outrageous, right? $27 is a drop in the bucket, right? So that's the deal there. Once we have a good feel on what we would need to do if you are a candidate, then we'll move forward right then. There's a lot of different variables to determine what needs to be done and how much. For instance, do we need to do some of these biologics that I've spoke about? Do we need to do all of them? How much of them do we need to do? Is there what the volume needs to be? Are there any supported modalities to go with it? So all these things have to be determined, and then we figure out, and that lets us know. So that's all I have for you. I'm glad you all listened to me, and I appreciate it. I'm gracious. I'm glad I'm here. So thank you for having me. Any questions?
Question.
Yes. Can't see
You know when the spacing is gone and you inject stem cells and it regenerates, and so how long will it last? Or you have to do it more times, or why would it get gone again?
That's a variable question right there. It really depends on how bad it was. For instance, what we've shown in the research is that stem cells can last in an area for quite some time, right? So think of it like the construction crew. It builds, then you have the final product. Now, how long that lasts depends on how well you take care of it, right? We don't commonly ever really get patients back for the same joints. We get people back for other joints all the time. We get a lot of people who say, well, we did this knee. Okay, now we'll try this one first, and once it's better, they say, okay, let's do this one now. So it's a variable question, but it can definitely be covered when you come in. Yes?
So I work at my computer all day long, so I have neck and shoulder problems. And with the exam, I don't have any MRI, X-rays or anything. So
Yep.
would the exam cover that?
Good question. So the exam, we would sit down, talk to you, get any imaging that we would need, and I believe we could send it out, and insurance would cover that. Yeah. So we would determine. Yes.
You did mention accidents. I was T-boned on an ankle. And it was reported that I was rear-ended, but I wasn't. So I spent 5 years working on being rear-ended, but I was not rear-ended. I was T-boned, and so now my head went this way, not forward.
gosh.
So I wasted 5.5 years. My life is, I've done nothing. I can't lift anything with my left arm because C5 is affected, which actually makes the motion for your
Shoots,
left
yeah.
arm. And I have a tear in the anterior ligament, so I have instability, TMJ that they missed. So I'm a wreck.
Yeah.
I
Yeah.
haven't lived in it's gonna be 6 years, and I wanted to give up.
So sorry to hear
Because
that.
I was very active, and now I just sit at home. So would those kinds of technology be able to deal with, because I have one new doctor who said I will never find relief.
Wow. Well, no, that's the last thing you want to hear, right?
Well, he
Golly.
doesn't really want you to do very much.
Yeah. First off, I'm sorry to hear that, but yes, we see people who've been in car accidents all the time. That's more of that macro trauma type of deal. Yours was just very significant macro trauma. We'd have to look at the imaging and see if you're a good fit. You may be, you may not be, but we do see car accidents all the time.
I was referred to do the PRP
Okay.
because of the tear.
Okay.
And the instability, and would this actually work for both the bone and the tissue?
Absolutely. The stem cell is going to be like the holy grail, if you will, of biologics. PRP is great, has a time and place. Like I said, it's good. It's great with tendons and ligaments. Especially in a younger type of person, like a college athlete or something like that. So that type of deal. So we just have to determine. It might be what you need, but we'll do an exam, find out. Anybody else? Oh, right there.
Question for you. I've got multiple issues. So I've got both knees, bone. I got shoulders 25 years ago that they said that need to have surgery. I've got upper spine, lower spine, and carpal tunnel. I got the full gauntlet.
The whole deal. Yeah.
So
Yeah. No, we see patients like that all the time. Okay. And it might be one of those things where we look at you and say, okay, you're a good candidate for these two joints, not so much these joints, or, depending on what we see.
What was your question, sir?
So the long question would be, how long would it be to work on these things to get something done going? Would it be ongoing treatments? Would you treat what the length of the process?
It's so we do mainly programs that go to maybe more than one treatment, maybe not. It really is so much variable. I know I keep saying this, but it's so much on the imaging and the physical exam, the orthopedic evaluation, and/or neurological. Those answers we can give you 100% right when we get you in.
Every time I go see a doctor, they want to only do one shoulder for an MRI, then go in for another shoulder, then go for the spine, then go for one.
They want to go one area at a time.
I'm like, how many times am I going to get radiation?
One area at a time. That's what we always, we run into that a lot. I know it's frustrating. You just want to get this whole thing taken care of. So we'll get you in. Okay? Question though? Sorry, I can't see very well with the lights.
Insurance is not covered.
Yes, there's no insurance coverage. Okay? The traditional route, the steroids, pain meds, portions of your surgery, usually you're still paying a good amount with the surgeries, right? But all the other modalities, those insurance covers. Biologics, any type of natural healing, they don't cover. So I can tell you this, the pricing, all that's going to be really variable like everything else. I hate to keep giving that answer, but I promise you this, we have affordable payment plans for just about everybody. Majority of our patients are, almost everybody's retired. A lot of them are on disability, and they're able to swing it. So that'll all be covered as well. Yes, sir.
I was wondering, under what conditions would a person not be a good candidate?
Hey, good question. So the joint space, there's nothing there at all. If they're too far progressed, they wouldn't be a good candidate. If the patient had active cancer in the area, they wouldn't be a good candidate, because what we're doing is we're working to regenerate, right? Regenerate, make your cells supercharge them, make them replicate and do better, right? So that wouldn't be a good fit. Anybody with an infection, of course, that wouldn't be a good deal either. Those are the main ones. So any type of severe degeneration that's just too far gone, or a disc that is just too messed up, if you will. So.
If you had treatment, would you be not able to do certain kinds of things for a certain period of time?
Great question. So he asked if you have treatment, do you have to take a break and not do certain things? That's the beautiful thing about this, is that most people resume normal activities, that day or the next day. If somebody injected your knee or something like that, of course you wouldn't want to go run a marathon the next day, right? But you can do your normal activities immediately after, in most cases.
Some of the possible side effects, for this kind of treatment, I mean, it's in a sense natural, but in a way it's not natural, right?
Sure.
Using stem cells, right?
Side effects, that's the thing. Anytime you introduce a needle into the skin, full disclosure, we've never had one at any of our locations, but you do have to note it that there could be a site of infection when you go into an area, right? Anytime you go in an area. That's one of the amazing things. The downtime side effects are so minimal. And of course, if you had a cancer, like I said, we wouldn't want to go into the area of that.
No, but if you're getting all these things into the site of concern, isn't other parts of the body going to be affected by the presence of these
There's
cells?
There's potential it could affect other areas positively. It's all natural biologics, mainly coming from you. So that's why the side effects are so low. Other areas being affected, we've heard plenty of reports of that. Whenever we pick an area, say a hip, that's the area we're working on now. We hope you get other benefits elsewhere, which we hear a lot, but we can't. We're not going to hang our hat on that. We have other different treatments that could help with other things.
If I may, were you asking if it would affect other parts of the body negatively?
Yeah.
Right. So we have these healing molecules and cells that are currently in our bodies, and it is replenished. So yes, about side effects. I mean, yeah, you're temporarily sore for a little bit, but these are your own natural healing factors. Right? So that's why there are usually no side effects.
That's why.
Has there been long-term studies done on possible effects of these kind of treatment?
There's a lot of studies. So stem cell treatments were actually first started in the 80s. That was very rudimentary, very early. We've progressed a long way. So they haven't had any long-term negative effects, right?
That's a common question I get, right? It's like,
Yeah.
okay, I get my stem cells taken out, right? Okay, so then doesn't my
Body need that? And the answer is yes, but stem cells are able to replicate themselves. Right. So give it time, and it's like we didn't do anything. Right.
And it's from the area that if it's taken from, so it's going to replenish. Anything that we take is going to replenish itself because they're such a high concentration of stem cells. It does what it's supposed to do, and it replenishes the areas.
It isn't like taking from Peter to give to Paul. Peter, something happens to Peter.
Yeah.
There's not- it's
Good
nothing
questions.
like
All
that.
good questions.
Question over here. Can you briefly explain the actual process of extracting stem cells or plasma based on the different therapies? I mean,
Yes.
what is that?
Yeah. So there's the main ways that we would commonly do to extract the stem cells. We go in a little area in the hip, okay, numbed up. Like I said, you're sore for 1 to 3 days. We take out the bone marrow. Okay, that has a high concentration of stem cells in that area. We filter it, centrifuge it multiple times to separate to get the right quantity, and then we take it and inject it where it needs to go. Okay, so it's not it's not painful like a biopsy, bone marrow biopsy. People who have that and they go, oh, those are painful. Not like that. Like I said, sore for 1 to 3 days typically, but you can still resume normal activities.
That's an outpatient thing? Like
Correct.
you're out that day?
Outpatient. Yes, sir. For the PRP and A2M that I talked about, those are molecules coming from the blood. Okay, so that's all it's a blood draw, and they're processed differently. The PRP is to specifically get the plasma, and then the A2M is to go a whole nother step and filter it to get an A2M molecule that's in the blood. It's just not in a high enough quantity to where it does its job like it used to. Yep. Yes.
Can I jump in real quick with it? So I'm not a needle guy. I'm not a big fan. So when we talk about pain and discomfort, the only thing that resonated when I underwent was pressure. You do feel pressure, but you don't feel pain. I don't, if that makes sense. And when you mentioned before you're sore, I was sore, but I was outpatient, left the same day, next morning, could feel it, but within the next day, it was back to regular, back to normal. Because when we first met, talking about, well, we're gonna take a draw from your hip, and we're gonna take it all out, and we're gonna I went, oh, I don't know about this.
How big's the needle?
Yeah, but trust, and it was awesome. Dr. Charles, actually.
Yeah.
Excellent,
Yeah,
excellent.
he's excellent. Yeah. Thank you for that. That's good.
Rick, how's your golf swing today?
I can swing a club, but I can't hit the ball.
That's two different things.
That's tough. That's tough.
Since I suffered a poly trauma, not just a main trauma, but poly, because it's all over, how many of those can you do? And what is the time period between?
Typically, I'm sorry.
It's just like I have, it's all over me now.
Yeah.
So it just.
Commonly, we could do multiple joints at one time. So if you have issues all over from an accident or anything, we can do that. Now, in between, if we wanted to do more, most of our providers are going to say at least 6 months or so, but it really just varies. It varies. But we can do, say, if you had neck, shoulder, low back, we can do all of that all at one time. So that's one of the cool things too. We just have to get a bigger sample.
I have a fun question.
Yes, sir.
So if people from this seminar sign up for like a long-term treatment, what is Rick's commission on this?
More pain.
And for your patients and
Uh-huh.
stuff, have you done any research and testing on their genes and if the tips have been rehabilitated on the genes, on the gene stems?
You're using the plasma from the patient, their
Yes,
own
from
plasma,
you.
because I hear young people selling their plasma
Yeah.
at all these locations for
You're not getting
$200,
somebody
$500.
else's.
I'm like, Okay.
Yeah, look,
Where's that
that-
going? I don't want to know, but
That was a good point.
You're using. I
Everything's
saw that.
coming from you, so that's very important because there's a
Your
0%
body.
chance. The checks and measures that it goes through, and then on top of that, it might not, your body might just fight it off and say and get rid of it, right? That's not a case with this. Yes. Sir.
I just read this book, Cheating Death, and it has a whole chapter on stem cells.
Really?
And I read it, and I'm just amazed at the advances that stem cells has made and what it can do.
It's unbelievable.
And it's just beginning, and it's exciting. I think we'll be able to live forever, you know? Okay, but here's the thing. But insurance don't pay for it, like you said.
Correct.
So, wouldn't it be to everybody's advantage, yours, as an industry, the insurance industry, and patients? Because insurance, they're in it to make money. That's what insurance, like every business, okay? So, if stem cells, as keep on advancing, can help everybody reduce medical costs, because they don't have to go through all the surgery and all that stuff. It helps the insurance companies because they'll be saving money if they cover this, and the patients would get better. They'd be served too.
You're 100% right, and that is going to happen one day. I wholeheartedly believe that. As it stands right now, anybody know who funds insurance companies? Pharmaceutical companies. So if I'm giving you $50 billion, right, and you want to do something else, and I don't want you to do that, well, then the money stops, right? It's all money thing. And this is, I have to say, disclaimer, it's my opinion, right? Yes.
What's the oldest patient you worked on?
Oh gosh, 102. I get that question a lot. 102. You had 100, okay, you had 103. Okay, there you go. So 103.
What's the youngest?
Youngest, let me think. Probably, you had 16. I was probably about 19. So you got me on both angles there. Yeah, probably 19. Probably 19.
What kind of treatment for 19?
19 will be a lot of PRP, depending on what they have going on. If they have some kind of systemic issue, but the one that we treated at some other clinics, some of our doctors, it was PRP.
I will say my 16-year-old patient, so she ended up going through the full program with the stem cells and everything. So she's a soccer player, tears her meniscus in the knee, thing is swollen fast, she can barely do anything. Wasn't for surgery, the pain never went away. And so 6 months later, they did a second MRI. The same tear was there. So the surgeon said, okay, let's go back in. And her parents were like, what are you talking about? Right? No, we're not doing that. So that's why she came to see us. Did the whole thing. She was back to running and playing soccer in, I want to say, between 8 to 10 weeks. Now, people that young, I mean, they heal like Wolverine, right? I don't know if y'all know who Wolverine is. They heal really, really well. So that's...
Yeah. Yes, ma'am.
Sorry. You mentioned hair and
Yeah.
skin, but we didn't talk about that. So
Yeah,
I don't
yeah,
actually
so-
need to worry about hair, but I'm
Yeah.
curious about it.
Yeah, so like I was saying, that they differentiate in all the different type of cells, right? It's basically wherever you put them is what stem cells have the potential to regenerate, right? So what we do commonly is we can put them into the scalp area for hair, and it helps stimulate the follicle to actually push more hairs out. Because as when you have a full head of hair, typically you're pushing 3 to 4 hairs out of a follicle, right? Over time, okay, now it's 2 to 3, now it's 1 to 2, now it's 1, now it's nothing, right? Idea is whenever you're getting to where you're 1 or right on the brink of nothing before it becomes dormant, you inject the area to help stimulate the growth and push more hairs out, essentially. For the face, same deal. It's microneedled into the area, and we put them right into the area so it can help with the fine lines, wrinkles, help pump the face type of deal, help regenerate the skin. Oh yeah, really cool stuff.
With the skin, is that permanent?
And you know, you're probably going to want to do a touch-up every few years or so. You know, because you're going to be happy with the result.
He looked at me, he said, every few minutes.
I have a question.
Yes, ma'am.
For eyesight.
You know what? There's actually some really good studies out. We don't do that, but there's some really good studies. They do eye drops, especially for glaucoma, and then eyesight as well. But there's some good stuff out there. You know, really anywhere that there's a deficiency or an issue, then it can help. But we don't do that. You know what? I don't. Do you know, Dr. Sun?
I don't think so. I'm not sure.
Yeah, it's really, really early in that stuff. I was just reading something a few months ago about it.
There's a book called Life Force by Tony Robbins. I highly, highly recommend that. So Tony Robbins is he's a pretty famous public speaker, motivation type of guy. He wrote this book after his personal experience with stem cells. He was told that he had to fuse his entire neck, or he's one fall away from becoming a quadriplegic. He said, nope, not doing that. The stem cells can have to get it done. And he's all good. So this book is based upon interviews from the top 100 doctors in the world in regenerative medicine and anti-aging. Now these stem cells, because they can turn into different types of cells, the applications are endless. In the book, it tells you once the 3D printing technology becomes available, what will happen is they will print the scaffold of an organ, let's say a kidney, lung. They will populate the patient's own stem cells into that organ, and you essentially have a second set of organs that are yours. No anti-rejection units, because the brand new organ is structured perfectly the way they want it to be, and then they just surgically transplant it in. So that's the kind of stuff that people are working towards.
It's endless.
Fascinating. Fascinating.
I'm still getting used to cassettes to CDs.
They're growing organs.
Wow. Gee. May I ask location? Where the clinic is where, and multiple locations around the state?
Yes. So we're really all over. Dr. Sun he can answer all the locations.
Here in Honolulu, so we're at the Honolulu Medical Building on Heritage Street in Honolulu. There's a big medical building there with gas stations in the corner. So, orthopedic associates there, so a lot of locations already know. We have an office in Wailuku, Maui, also in Hilo and Kona as well.
Okay.
I have a question. So if someone has an autoimmune disease like myasthenia gravis, are you able to treat someone that has that?
The specific areas is where we would treat any type of systemic type of deal like that, where it's the thyroid, not specifically the thyroid. There are certain peptides and different things that we do that have great potential to help. But again, that's not mainly our focus.
Okay.
But there are potentials there. Definitely come in. We'll talk about it.
Okay. All right. Thank you.
With regards to, if you have a polytrauma, so if it starts at C1, right down to T1, and I've developed scoliosis because of that, and now it's actually, I can see my toes spreading on my left side to do the balancing. So I'm actually really progressing a lot faster than I would have ever, I didn't even know that this was happening. If you could repair from a higher level, like a C1, C2, C3, and you somehow,
very well could, because if the reason why there's a curvature is because of muscular imbalance, or there's a damage over here, so it's causing this to pull a different way, absolutely.
You were talking earlier, you mentioned diabetes.
Yes.
And the injections, spiking your sugar levels with on your procedures, is that?
Not at all.
Not
at all. Doesn't
or
affect
does
it at all.
decrease at all, or doesn't?
It won't affect the procedure. So the symptoms of diabetes, like neuropathy, the burning, numbness, tingling, if anybody's heard or had that, burning, numbness, tingling, hands or feet, absolutely, we work on that all the time. But any of the injections we do are not going to affect the sugar. Yeah. Yes, sir.
I was talking to somebody before the meeting, and the person said that, this treatment doesn't always work, right? You may be a candidate for treatment, but the results are not guaranteed.
No. Yeah, there's no, look, one thing is there's, in medicine or anything in life, right, there's no 100% guarantee. But, we do everything.
What's the percentage of success?
We're not conducting our own studies specifically. I tell you, they're very, very high. Got a walking testimonial right here. We have 1 million more. But we're not doing studies right now.
So, I guess when you interview a patient, you kind of evaluating whether the patient, treatment will be successful for the patient, but are you giving like a percentage of success, or?
We're going off our knowledge and doing this for a long time. There's no, like I said, there's no absolutely 100%. Now, I will tell you there is a study that we didn't conduct. It was an injection of stem cell into a hip, I believe, and it was an 82% satisfaction rate, right? That was with just one injection. We do whole programs, so I couldn't sit here and legally sit down and say, it's 94, right? But I can't sit here and tell you that, but I would definitely be willing to feel it's much higher than that.
At what point would you tell the person that you was going to talk to the person?
If we weren't going to help, we wouldn't take them.
Suppose if you meet the criteria for being a patient, and then you have them go to the treatment, but there's some particular point, they're not making progress as expected. At what point do you tell the person you can't help?
That's a variable question, because it depends on how bad it is, what condition it is, and what the issues are. So yeah, you want to.
So the tough thing is, we have patients coming on wheelchairs. They're not even able to walk, and the damage is really bad. And sometimes they're not even a surgical, right? So when someone comes in, their function is, they can barely do anything. They have a lot of things that work against them, like they're really heavy, for example, right? And the damage is really bad. What I like to do is I want to get their thoughts on surgery first. Okay, is it even an option in the patient's mind, right? Because also another thing is, if the patient is not optimistic, or they're really not wanting surgery, there are studies on the surgical outcomes not being as good, right? So then, what I like to say is, look, if that's the case, the way things look right now, if you still want to do this, me sitting here telling you, look, this is not good, then I need you to be okay with having zero results. You still want to move forward, I will do everything that we possibly can, but I need you to be okay with not having results. So I'm just a straight shooter, same with Dr. Bourgeois and all the people that do this is, we have nothing to gain by telling people, hey, you can buy after this, and then they can't do that, right? So that's how I
Be super upfront with you. Tell you how it is. And hopefully it's good, and if it's not, that's something we have to deal with, right?
Dr. Bourgeois?
Yes.
Dr. Sun?
Yes.
How many years of experience you guys have doing this type of?
For me personally, 7 years.
4.
4 years.
Yeah.
And how long has this office been in business in Hawaii?
Yeah,
4.
4.
4 years.
And you said it's been around since the 80s?
It's when the beginning, when the start of the research and everything was in the 80s. They kind of, okay, the stem cell seems to be something, and then it kind of progressed from there. So, got a lot bigger in the 90s and a whole bunch in the early 2000s, and then we're here where we're at now. So it's still every day progressing. Like Dr. Sun was saying, they help regenerate regrowing organs. I mean, they have studies where they're injecting them IV and helping people with strokes, right? Helping reverse the damage from strokes. I mean, liver damage, kidney damage, you name it, any organ, right? So it's really, we're evolving with the times. Yes, sir.
I think the warranty on my brain has expired. And so I'm just wondering, when will stem cell science advance so that I can have an Einstein brain?
When you find that out, let me know. All right?
I think we're scheduling that for Tuesday.
Yeah, find out Tuesday.
We should be okay. Final question, please. Yes, sir.
Yeah, you mentioned Mayo Clinic. You mentioned Mayo Clinic.
Yes, correct.
So they've been, how long have they been?
Oh gosh, I don't have an exact date, but it's not recent. I mean, they've been doing it for, I would be willing to bet 20 years or more. I'm not 100% on that, but a long time. It didn't happen. It didn't start last year or anything like that. Yes, sir. Good question.
Just a last comment on the longevity of it. I was made aware that back in the day, we all remember the late, great Kobe Bryant.
Oh, yeah.
Kobe was an incredible player. Did you notice he never went down to an injury? He was very consistent. What he would do was travel to Germany and other European countries to undergo stem cell treatment in order to bolster, repair, etc. So it's been on the books. We're notorious in America for hyper-regulation, especially FDA, etc., for approvals. But now that we're in the game, so to speak, no longer have to go internationally. We can do it right on Baratania Street. And so the fact that it's recent, I think, is indicative of the clearances that had to take place. First of all, thank you very much for attending.
Thank you.
Thank you. It's really very special to see so many of our friends that listen. Dr. Lawrence Bourgeois as well.